Y pasamos entonces a nuestra última plática. Nuestra última plática es a cargo de Eito Milayo y Emisi Babatope. Es estudiante del tercer semestre en doctorado. La plática va a ser en inglés. Artificial Intelligence Role in Sustainable Development Goals, Human Well-Being. Case Study, The Elderly. Entonces, por favor, Eito Milayo. Sí.
Good morning, everybody. I am Eito Milayo Yemisi Babatope. Can you hear me? All right. So I'll be presenting the topic Artificial Intelligence Role in Sustainable Development Goals with focus on human well-being. And our case study for this discussion is the elderly. Next slide, please. So for our discussion today, I have some items which are discussing the concepts and the goals, sustainable development, then talking about the importance of good health, talking about Alzheimer holistically in terms of the overview, the courses, the statistics, the diagnostic approaches, and then the influence of AI solution in health. And I'll be discussing the objective of my work, instrumental activities of daily living and Alzheimer disease diagnosis, as well as the method I will be using and my research contribution. Lastly, my conclusion and references. So I go into the presentation. Next slide, please. So by definition, sustainability majorly is avoiding the depletion of our natural resources in order to maintain an ecological balance. The aim of this is to ensure that the current opportunities we are exploring does not deprive the future generation of the opportunities or deplete the natural resources that we are using. So sustainable development is just a concept of improving the standard of living without jeopardizing the ecosystem or causing environmental challenges. So this major concept is centered around three pillars, and they are the economic, the environment, and the social or the society. The next slide. Okay. So before I discuss the sustainable development goals, I would want to mention that before this, there was a Millennium Developmental Goals, which was signed in 2000, in the year 2000, and it was in a meeting where leaders of over 180 countries met, and they decided that they were focusing on about 8 goals, which are centered majorly on eradicating extreme poverty, putting an end or reduction to child mortality, and some other things. They decided that this will be achieved between the year 2000 and the year 2015. So in the year 2015, these same leaders gathered again at the United Nations headquarters and transitioned from the Millennium Developmental Goals into the Sustainable Development Goals. And in these particular goals, they are focused on about 17 goals, which are focused on improving our planet, making our planet safer, and building a prosperous planet so that we all can have a normal or good well-being. So my own work focuses majorly on the third goal of sustainable development, as we can see in this slide with the red icon, which is good health and well-being. This goal centers around improving the health of every age, every humans. And there is a saying that health is wealth. In other words, the absence of disease in our mortal body helps us to go about carrying on with achieving our daily goals. Next slide, please. So I say again here that the health and well-being of humans is very necessary to leading a successful life. So due to improvements in the healthcare system, the life expectancy over the years has been on the increase. But we should note that the more we age, the more old age-related diseases set in. One of them is dementia, of which Alzheimer is the most common type. So it is sad to say that this Alzheimer disease has the capacity of hindering people's emotion, their social health, and also their physical health. And it does not just affect those that are living with the disease. It, however, affects the family members and the caregivers. That is why I'm interested in procuring an early diagnostic approach to this disease. Next slide, please. So I'll be talking about Alzheimer's disease. It is old age related, like I mentioned, and its presence causes a neurodegenerative effect on the human brain. In other words, it affects the human brain, and the effect it has on the human brain is irreversible. Drugs are not available at the moment to cure this disease. Neither is there a way we can protect or prevent our loved ones from having this disease. So the best bet is to ensure a rapid detection or a fast diagnostic approach of this disease, so that once this disease is detected in humans, we can improve their way of life or improve the surroundings, their environment. Their family members can make necessary plans that are needed for their aged or loved ones to live a normal or close to normal life. So the cause of this disease is unknown, but there are some risk factors that have been identified. Some of them are the genetics, brain injury, family history, cardiovascular diseases, and sometimes the physical activity or the kind of diet. I will go to the next slide. Next slide, sir. Okay, so I'll be talking about the statistics of this disease. First thing I'll mention is the prevalence, which is the exact number of people that are currently living with the disease. As at the year 2019, report has it that we have over 55 million people currently living with the disease worldwide. In other words, if you take out of a population, if you take a sample size of 9 persons, 9 elderly people, you will discover that at least one of them has Alzheimer's disease or some other types of dementia. Over to the next slide, sir. I'll also be talking about the incidence. The incidence is the number of new cases that we have every now and then. Statistics proves that in every 3.2 seconds, we have 1 new cases of Alzheimer or the other types of dementia. The fact that this disease does not have a cure or is not preventable is not even the major concern. The major concern is that it kills, because it affects the mental health of people, it affects their social health. So it's been stated that it is the 6th leading cause of death in the United States. So this does not, the prevalence and the incidence and as well the mortality is not just the issue here. We also have the financial implication of this disease. There is some cost associated, whether directly or indirectly, to family members in taking care of their loved ones that are diagnosed with the disease. So in the entire globe, it's stated that in 2019, the global cost of dementia is around 1.3 trillion US dollar, and that is about it's about 1.0%, 1.09% of the global domestic product of the entire globe. So we've mentioned also that this disease has a social burden on both the people, the family member, and the caregivers. I go over to the next slide, Sarah. Now, the current diagnostic approaches, they had the MRI, the CSF, the blood biomarkers, but it's sad to say that these approaches have one disadvantage or the other, some of which could be costs and some of which could be the exposure to these imaging devices. And sometimes when we talk about blood, scientists or medical professionals have stated that blood is not sufficient to diagnose this disease. We also use the cognitive assessment, which is like a questionnaire where patients will be asked already degenerated patients will be asked how well they carry out their daily activities, and then they will be scored and graded based on this assignment. Sometimes this assessment is not perfect because most patients at this time do not remember or cannot think like normal people can do. And sometimes their caregiver do not give sufficient information that is needed for correct diagnosis of this disease. Hence my interest in profiling an artificial intelligence method for diagnosing Alzheimer. Next slide, sir. Okay, we cannot say less of the impact that artificial intelligence has had in our entire globe, specifically in the health sector. We know of AI-assisted robots. We know of correct diagnosis of cancer using AI. We can also speak of virtual nursing assistants and also some health monitoring devices that patients can use to monitor their state of health. So I believe that artificial intelligence can help us in achieving this main sustainable developmental goal, which is to ensure a healthy well-being for people living with Alzheimer's disease or the old or elderly people in general. I'll go over to the next slide. Next slide, sir. All right, so the objective of my work is to explore an artificial intelligence approach in early response of diagnosis of Alzheimer's disease in order to achieve this third goal of the United Nations by using the deep learning algorithms. Next slide, sir. So now, what are the metrics or the things that we want to use in diagnosing this Alzheimer's disease? It's been proven by Charles Babagar that instrumental activities of daily living can predict existence of dementia or Alzheimer in patients. In other words, these instrumental activities of daily living, they revolve around things that people do normally and that requires a little bit of high level of reasoning, some of which is housekeeping, some of which is paying your bills, some of which is using the public transport, some of which is taking your medication, making a call, managing your finance. These are some of the activities that I will be looking at and checking the quality of this activity to be able to predict whether there is presence of Alzheimer's disease in a person or not. So instrumental activities of daily living, in short, has been a proven tool to cognitive impairment in humans. Next slide, sir. So my work will be focusing on collecting instrumental activities of daily living data, monitoring them, evaluating them, and predicting the existence of Alzheimer to be able to test and tell whether people are cognitively impaired or not. Some of these activities, I've mentioned them, and this kind of data will be collected by using wearable cameras, humans putting on wearable cameras while they are performing these tasks in their work. So the uniqueness of this work is that it's not based on reported assessment. It is based on real life scenario being captured and evaluated. Next slide, sir. So once this kind of data I mentioned has been collected, I will be passing this kind of information through deep learning algorithms that would be trained to extract the necessary features that we will be looking for. And then after the feature extraction, these features will be classified based on the instruction in the fully convoluted neural network layer, and then classification will be sent to the final output, which is to diagnose and tell whether a person has Alzheimer's disease or the person does not have Alzheimer's disease. Next slide, sir. So this is just a pictorial diagram of what I explained, wherein we pass in input data, which are image, and then we analyze them, we do the feature extraction, we do the classification, and then we tell whether this person is cognitively impaired or not cognitively impaired, which will be the basics of this work. So that's my research contribution, working on deep learning algorithms to perform this kind of classification. So over to the next slide, sir. Majorly or in conclusion, this is what my work entails, and it is ensuring that the age group, those are the elderly, have opportunity to good health and well-being, and as well reduce the mortality rate by improving this diagnostic approach. So AI solutions that help sustain good health are vital, hence the necessity for my work. So work majorly focuses on improving the quality of life lived by patients so that we can discover or diagnose disease early and then improve their quality of life. So that's it from my hand. Next slide, sir. The references I used are here, and then thank you so much for your attention.
Thank you very much. Just in time, I was about to warn you about time left, but we didn't need to do that. Okay, Tanya, do we have any questions?
Yes, we have 3 questions. The first, do you know the prevalence in Mexico about this size?
Okay, I actually checked, but I couldn't get the statistics of Mexico. Most of the work or the statistical analysis done are using US as a case study or using the general globe as a case study. So I've not been able to get the exact prevalence in Mexico.
Okay, the second is, are you collaborating with some medical doctors? How far are the scientific approach for patents?
Okay, that's a very good question. I forgot to mention that AI in itself cannot be done basically by computation. There is need to seek the advice of experts. So in this work, in my second semester, or my first semester, I think second semester, I was at the Department of Geriatrics in Mexico City. I can't remember the full name of the institution, but I think it's called INC. I can't remember the name of the hospital, but I met with some experts. Those are medical doctors in the field of geriatrics. Those are the departments for elderly people where we discussed about this work. And then, so I would say we are collaborating with experts in this field. So we are getting the necessary advice that we need. And then there is a check on the kind of work I'm doing. So that's it.
Thank you. And the last question is, I have heard about some device that measure the electroencephalography. I wonder, what do you think regarding this technology in having any chance to help detect Alzheimer with the help of artificial intelligence?
Thank you so much for that question. As regards AI in detecting Alzheimer's disease, many approaches are being used, some of which is this one mentioned, the EEG, ECG, and the MRI. Scientists used that majorly, and they apply MRI in reading this kind of results and then predicting the presence of Alzheimer. So these are, if you check literature, like if you search the internet, you will see that work has been done in this area. But in this aspect, work has not been done in this aspect. So that's why I'm intending to explore these routes and not use the already existing routes where others have been using. So that's it.
Tania, creo que no tenemos tiempo para más preguntas, estamos justo a tiempo. Tengo algún problema, no sé si pude enviar al chat el enlace para la encuesta, pero te lo envié a ti. A ver, no sé si tú lo puedes poner disponible a toda la gente, por favor. Y pues, Tomilayo, thank you very, very much for your talk.
Thank you, sir.
Y no nos queda más que hacer el cierre. Para ello, Luis, te voy a pedir si tienes a la mano alguna de las reconocimientos o quieres que creo que yo los puedo compartir. A ver. No, si tú lo puedes compartir, te lo agradecería. Muy bien. Nosotros en Citedi generalmente agradecemos la participación de la gente en nuestros eventos. Aunque se trata de nuestros estudiantes esta ocasión, no podemos dejar de reconocer su participación. Perdón. Y el reconocimiento es el siguiente. el Centro de Investigación y Desarrollo de Tecnología Digital del Instituto Politécnico Nacional otorga presente reconocimiento a, y aquí voy a decir a Marco Antonio Morán Armenta, a César Miranda Mesa, a Martín González Ruiz, a Edito Milayo de Vice Baratope y a Misraim Javier Martínez López, por haber impartido la conferencia respectiva en el Centro de Investigación y Desarrollo de Tecnología Digital, en el marco del Seminario de Primavera sobre Sistemas Digitales, el día 11 de mayo de 2022. Atentamente, la técnica al servicio de la patria, el doctor Julio César Rolón Garrido, director de Citedi. Muy bien, no nos queda más que suplicarles una vez más que llenen, respondan la encuesta. Les prometo que no se van a llevar más de 2 minutos, está muy sencilla y nos va a ser de muchísima utilidad para eventos futuros. No sé si alguien quiera aportar algo más, algún comentario adicional, y si no, pues estamos justo a tiempo. Les agradecemos muchísimo su participación, su asistencia. No dejen de consultar nuestra página y nuestras redes sociales para futuros eventos. Muchísimas gracias. Que tengan ustedes una estupenda semana. Hasta luego.